Hello and welcome to the Imprint Weekly Podcast. I'm John Kelly, Senior Editor of the Imprint, a daily news site covering child welfare and youth justice around the country. You can read all of our coverage at imprintnews.org or check us out on Facebook or Twitter at the Imprint News. You can also sign up on our homepage for our free weekly and monthly newsletters. And for professionals in child welfare and youth justice, subscribe to our Youth Services Insider section for a closer look at news on business policy and practice. The Imprint Weekly Podcast is also a member of the Safe Camp Audio Network. You can check out our show page and all of Safe Camp's other great podcasts at safecampaudio.org on the web or at Safe Camp Audio on social media. Today we are going to go through just a few headlines of late from child welfare and youth justice. We are also going to talk to Marina Nitze from the Child Welfare Playbook. You might remember that name. She's been on the podcast before. We're going to talk about what states have been up to since the Biden administration finalized rules aimed at making it easier to license and financially support relatives and other kin as foster parents. I'm going to start by recommending that folks read the excellent summary of what's going on with the Green Hill facility in Washington State. It is the state's only maximum security juvenile facility. Our story by Jeremy Loudenbeck is up on the site now. And of course, as usual, I will drop a link to that into the show notes. So basically, the situation is Green Hill has sort of been lauded in the past for creating a lot of pro-social youth development-oriented programs for youth who are adjudicated for very serious things and are in this maximum security facility. Several years ago, the state approved a policy that for the first time enables young adults up to the age of 25, tried as adults, to serve the portion of their sentence up to the age of 25 in Green Hill. Since that time, there have been all kinds of problems, including violent incidents, staff misconduct. At one point over the summer of this year, it was actually literally overcrowded with several dozen more youth and young adults placed there than the facility is kind of zoned or has a capacity to accommodate. And there's a little bit of a legislative food fight now over what is really the cause of this. Some people are blaming simply the policy, which was, I think, called JR to 25. Others who in particular were supportive of that policy and kind of shepherded it along are saying that this is poor management and the policy itself could succeed in the right situation. I think there's a room for reasonable debate, and I think Jeremy does a good job of explaining and kind of laying everything out that's happening. I just wanted to point out, so I would just recommend reading the story. It's not a long one. It's just a good sum up of what's going on there. I just wanted to add kind of two things that jumped out to me as sort of resonating with other journalism and reporting, both that we've done and others have done in the youth justice space of late. One is, like I said, there's clearly several contributing factors at play in what's going on at Green Hill, but one of them is understaffing. And it appears to be brought on in Green Hill by a high rate of turnover. So people having jobs and then leaving them, likely at a very quick pace. And then no-shows, people who are employed there nominally but aren't showing up for work all the time. Both of those are really indicators of being a place that has jobs that nobody really wants, which means you aren't typically going to get the best people. And when you combine that with the fact that this facility has clearly documented incidents of staff misconduct and violence inside and all kinds of problems, it really reminded me of something a juvenile justice expert told me one time when I was covering research that had come out about sexual victimization within juvenile facilities. And this is, I want to say, sometime around like 2009-ish, maybe around there. It was the Bureau of Justice Statistics that put it out. And basically it found a very high rate of reported experience of victimization. And one of the things when you drilled down into it was that there was a very high rate of staff on youth victimization. And a lot of it turned out to be, in some instances, like kitchen staff, things like that. Anyway, that is not really the point. There was one facility, I think it was Pendleton. I think I'm pretty sure it was called Pendleton in the Indianapolis area, that had been kind of identified as having one of the worst rates of victimization. And I reached out to somebody, Mike Dempsey, who's now the head of the Council of Juvenile Correction Administrators, which is a national organization. At the time, he was involved with Indiana juvenile justice, and I asked him to what he attributes the problems. And one of the things that he called out at the time was that they had something like 90% or more turnover within a year at the facility in question that was called out in the report. And so basically what he was implying, I'm sorry, I'm kind of working off of memory here. I'll try and dig up the story and put it in the show notes. But I think his point was, at a place where there is high rates of turnover, you run the risk of the people who end up staying there being exactly the wrong people, the people that you don't want, just as likely, I guess, as those being the ones that are willing to stick it out for the kids. I think he'd probably get a mix of both. But anyway, I think his point was to kind of highlight that in the case of the Indiana facility, there were staff who were comfortable being sexually aggressive or suggestive with the youth, and they ended up being the only ones that stayed. Everybody else was kind of turning over. They were not attractive jobs. So that was one thing, and that is something that we have seen in other places, right? There is, in the 90s, even in the 2000s, overcrowding in juvenile facilities was something that was driven by very high capacity places, or even just regular capacity places, teeming with young people who were there despite the fact that the place was kind of over capacity physically. Now, while Green Hill was literally over capacity at one point, more often than not, we're seeing stories around the country where there may be the appropriate, or at least a capacity tailored number of youth in a facility, but the number of people who are working there is so low that it's dangerous to operate even at a portion of the capacity of the facility. So that more than anything, in some places, the number of staff that you can even have on the grounds at any one time is kind of dictating capacity more than the walls and how many young people you could fit there. And then the other one that jumped out to me is that this is another instance in where the oversight and management of a juvenile facility became difficult, it broke down. And the solution that is being sought here, which is why Jeremy wrote the story, this is something that is going to be decided soon, is to move young people, youth and young adults who are in this Green Hill facility into adult prisons. Now, the other one that comes to mind is the situation in Louisiana. I believe this happened in 2022, and we talked about it on the podcast at the time, where there was a series of security challenges at a New Orleans area juvenile facility, and that prompted the governor at the time, a Democrat, John Bel Edwards, who has since been succeeded, to greenlight shifting all the youth at several juvenile facilities, including the one in New Orleans, I believe, to Angola Prison, which is one of the most notorious adult complexes in the country. And they basically assured everybody that there was going to be sight and sound separation, and they would not have these young people intermix at all with adults. But it's still putting them actually on death row. They used the old death row in Angola to house these youth. After a lot of pressure, by the way, legal and otherwise, last year they finally did move those youth out from Angola to other places. Another piece by Jeremy that I just wanted to recommend everybody take a look at is it is the 50th anniversary this year of the Juvenile Justice and Delinquency Prevention Act. So Jeremy sat down with the head of the Office of Juvenile Justice and Delinquency Prevention, Liz Ryan, to ask for her thoughts sort of on what the law has accomplished, what we're still needing to do, a few other things about federal policy under the President Biden's administration, which, as we all know, is winding up right now. So I will drop a link to that. You should check that out as well. And I'm going to try and get a special guest on the podcast who was involved in actually writing the Juvenile Justice and Delinquency Prevention Act way back when it became law in 1974. So hopefully stay tuned for that. All right, next up, and this one's kind of interesting. I'll sort of describe the situation that has played out in New Jersey with this private health care hospital operator and tell you why I think it's kind of interesting as a sort of data point in a bigger discussion when it comes to drug testing of either parents or newborns who were born in a hospital for drugs. So here's what happened. New Jersey last month sued a private hospital system called Virtua Health over its practice of universally testing all of its pregnant patients, which the state alleged is being carried out without the informed consent of all the would-be parents and is often leading to notifications to the state abuse and neglect hotline. So there were kind of two things that New Jersey was taking issue with. One was having a universal practice of testing all pregnant patients. They said that that was discrimination and bias. And then the other was violating the right of privacy by not seeking informed consent to do so. Now, it has since come to light by reporting from the New Jersey Spotlight News that Virtua has ended its practice of conducting drug tests on all pregnant patients and will instead screen them based on, quote unquote, and I'm quoting from the New Jersey Spotlight News here, patient indications. So they will move from a practice of universal testing to one where the screening would be based on patient indications. And here is what Daniel Moyse, who is the Virtua spokesperson, told the Spotlight News, quote, "This change has been under development since early 2024. Virtua is committed to providing the best patient experience possible while still ensuring that newborns receive the appropriate and necessary care, especially those who require additional care for neonatal opioid withdrawal syndrome, also referred to as neonatal abstinence syndrome," end quote. There's actually kind of a similar lawsuit brought by a New York mother against a hospital operator just up the highway called Kaleida Health earlier this year after the mom had a positive drug test that was prompted by her consumption of poppy seed bagel bites, and that led to a CPS report on her. Okay, so here's why I thought this was interesting. I want to mention it to folks, and we'll link to everything if you want to read up. But investigations into both child welfare and hospital drug testing policies have really found the potential for racial bias in these drug testing practices. And also, frankly, that a lot of the positive tests yielded involve the presence of marijuana, which does carry health risks for mothers and child, but is now a legal substance in a growing number of states. Just two kind of examples of sort of what's been unearthed of late in terms of research and whatnot. In 2020, an investigation into bias in drug testing moms by the New York City Commission on Human Rights found that Black women are more likely than white women to be drug tested before or immediately following childbirth, despite similar rates of drug use, and they are more likely to be deemed unfit parents. A 2022 paper published in Hospital Pediatrics looked at the testing of newborns in Connecticut, as well as the state's sort of novel policy about giving hospitals the ability to more generally report positive tests without always having to report a specific person to a hotline for abuse and neglect. The study found that nearly 8 in 10 notifications made from hospitals pertain to marijuana exposure, and that Black mothers were disproportionately overrepresented among notifications compared with the state population. Which kind of brings me to why I think this situation that played out with New Jersey and Virtua Health is so interesting, is that the sort of accusation was over, at least in some part, a universality approach, and ends up with a hospital going to a more subjective approach. Now, the American Academy of Pediatrics, AAP, has espoused a view that universal testing is the right way to go, but that it needs to be a public health response and not a punitive one. I'm just going to read real quick from something that they put out. A public health response rather than a punitive approach to the opioid epidemic and substance use during pregnancy is critical, including the following: a focus on preventing unintended pregnancies and improving access to contraception, universal screening for alcohol and other drug use in women of childbearing age, knowledge and informed consent of maternal drug testing and reporting practices, and it sort of goes on from there. But clearly, as you can see from that comment, what they believe is the right thing to do is to actually do universal testing on all pregnant women and newborns in hospitals, but not have that connected to any sort of surveillance. It's just a public health response. It's not a punitive one. New Jersey, in this lawsuit, kind of took the view that universal testing within the group of pregnant patients was in itself a form of discrimination. This is from Sundeep Iyer, who is the director of the New Jersey Division of Civil Rights. In this case, he said Virtua's practices single out pregnant patients for mandatory drug testing without informed consent. As a result, patients are unnecessarily traumatized and fear they will lose their children mere hours after giving birth. Virtua's practices violate our civil rights laws. and we look forward to proving our case in court. And it seems like they're not going to have to prove it. Reading between the tea leaves, and maybe I'm wrong here, it seems like they filed the lawsuit maybe because they thought Virtua wasn't going to ever make public their plans to change this policy. But at the end of the day, when you go back to what Virtua said here, they are moving to a more selective process. So they've ended the universal approach on pregnant patients, and they're going to replace it with the very thing that can lead to racial bias or other problems in terms of who is getting tested and screened and who is not. So it'd kind of be interesting to see sort of what happens next. I don't know that anybody will have the wherewithal to kind of monitor that and see what changes. But I think this case just sort of embodies like all of the different things in this very fraught conversation about when do we test people, when don't we, and what can those tests produce in terms of effect? Should it only be for a public health response and treatment? Should people notify somebody at CPS about them, etc.? All right, home stretch here, just a few stories of ours that I want to call out and recommend to people. Starting with a real group effort a bunch of our reporters worked on where we obtained some pretty hard to get information on the race and demographics of foster parents in Minnesota. And what I mean by that is not typically something that is well collected and distributed through the sort of typical national child welfare data sets. And so we sort of locked into, through kind of asking for it, some really good data and information about the race of foster parents in Minnesota. And what we found was that about 40% of Minnesota foster youth who are placed with strangers in foster care, and I don't mean that pejoratively, just not their relatives, 40% of those youth are Native American, African American, Asian American, or Latino. 80% of the foster parents who are strangers, who are non-relatives, are white, meaning transracial foster placements and adoptions are very common. So we sort of dug deeper into that, and it's not that those arrangements are inherently problematic, but most experts that we interviewed for this story found that the lack of cultural connection that can occur for children when they're separated from those with a shared identity can be profound, and there needs to be an effort to do more than just simply place youth with people of a different background. Quoting from Tiki Brown, who is the state's new Department of Children, Youth, and Families, it's one thing to provide safety in a loving home, but the layers of providing that care are really important as well. The more variety and diversity we can have means that we can have a better match for children in the system who are undergoing great trauma and don't need extra layers added onto it. So I'll drop a link to that story. Really good stuff by a whole bunch of folks here at the Imprint. Another story out of Minnesota worth noting, and I'll put this one in the show notes as well. Minnesota just became the 15th state in the country to lift restrictions on access to birth records for people who experience adoption in the state. Minnesota is just the most recent in quite a movement that's afoot in this space. The number of states that are granting adoptees such access has nearly doubled since 2019. There's probably not a more common, iconic image associated with the downsides of foster care than the sort of trope image of a trash bag full of a kid's belongings. This is depicted beautifully in a digital piece of artwork by former foster youth Carl Wyatt in his piece Moving Day, which I will drop a link to this story in the show notes, and we had permission from Carl to use that image in it. Obviously, it speaks to kind of the cold nature of movement, both into the foster care system and around it after you're a youth. If you get kind of flung from placement to placement, that doesn't happen to everybody, but it certainly does happen. We have seen states move towards doing something about the cold nature of this. Not really a perfect situation, but at least trying to move away from garbage bags to luggage. Maryland and Oregon are two states that recently passed legislation to require the provision of luggage for youth in foster care. Texas did the same, and they actually went a step further. It is actually making its child welfare agency, called the Department of Family and Protective Services, track the provision of luggage and all instances in which trash bags are used despite this law, which is kind of a rather refreshing attempt at accountability, really. The reason that we kind of stumbled onto this is because the state DFPS, the Department of Family and Protective Services, put out their first sort of report to the state on progress here, and just two pieces from the first annual report. Nearly 12,000 pieces of luggage were acquired to provide to foster youth. The majority of them were purchased by DFPS. About 5,000 were donated. And the department documented 62 instances in which a trash bag was used to transport a youth in foster care's personal belongings, which obviously is probably 62 times too many. They actually had to put in the report the reason why the trash bag was used in all 62 instances. My guess is that when no one's looking and no one forces anybody to report, the number is much higher than that. All right, really home stretch right now. First, I want to just do a quick shout out to a bunch of people on the Imprint staff, because I was just down in Atlanta. I was lucky enough to attend the Nonprofit News Awards put on by INN this year. And we had a couple of winners in our ranks. Associate Editor Julie Reynolds and the Imprint's Indigenous Children and Families reporter Nancy Marie Spears won the Breaking Barriers Award for the story and podcast project Healing the Children of Horse Nations, which we co-published with Voices of Monterey Bay. I think, to be fair, Voices of Monterey Bay co-published it with us. It was really a team effort between the two outlets. And that piece centered on equine therapy programs for Indigenous youth in rural Oregon. So they were winners. We also had a runner-up. Our own Sarah Tiano was a finalist for the INI Award on Explanatory Journalism for Fighting for Kin, which is really just a terrific look at the challenges that a Black woman faced in adopting her nephews who had been placed in a white foster home in Minnesota. So, like I say all the time, we'll put these in the show notes, read them, take a look. And last but not least, I just wanted to note the sad and untimely passing of Becky Shipp, who was a key Senate staffer on child welfare issues for many, many years. She worked for Senator Orrin Hatch of Utah, who has also passed away, and for the Senate Finance Committee, for which Senator Hatch served as a chairman for a long time, I believe. Shipp was instrumental in developing the Family First Prevention Services Act and was one of the kind of key people that moved that needle as they moved that thing along through lots of trials and tribulations. I was there for a lot of it, pestering Becky and others for details on what was going in the bill, how was it moving, how are they going to get votes for it, what was the opposition they were hearing. And Becky was always accommodating to me to the extent she could. I don't think she always told me everything, but she welcomed the fact that we as the Imprint were interested in covering it. I'm just going to quote here from Deidre Henry Spires, who is a fellow member of the Senate Finance Committee staff, or was at the time, reflecting on Shipp and her life. "We shared a commitment to children that went beyond political party lines. I'm sending her entire family love and condolences during this time of tremendous loss. She loved her family. Becky became more than a colleague. She was my friend. She was also somebody I knew to be very connected in a visceral way to young people who advocated for themselves and young people who experienced foster care." Just one more quote, if you'll indulge me here. This is from Lisa Dixon, who we've had on the podcast before, communications chair for Action Ohio. "Becky Shipp made us feel welcome and supported. She always took the time to listen to youth." So Becky Shipp, gone way too soon at 63. May she rest in peace. All right, when we come back, my conversation with Marina Nitze about what's going on in the process of licensing kin.
Before I was adopted, I felt like my life was already over.
My biggest fear was that I would age out and not know how to be sufficient on my own.
At a certain age, they don't want you, you're troubled and stuff.
The clock is ticking for the more than 125,000 kids waiting to be adopted from foster care. Help the Dave Thomas Foundation for Adoption prevent them from aging out without a permanent family. Learn more at davethomasfoundation.org.
All right, we are joined today by Marina Nitze, who is a fellow with both New America and Think of Us, and the author of the book Hack Your Bureaucracy, which we have had her on to talk about before. But for the purposes of this conversation, and hopefully more to come, Marina is also one of the central organizers around the Child Welfare Playbook, which you can check out online at childwelfareplaybook.com. Now, I am hoping that we can make Marina a more fixed part of your diet here on the Imprint Weekly podcast. We're going to try and get her to pop on with me periodically just to talk about interesting ideas and strategies on different topics that the playbook folks have bandied about and produced. And then my long game plan is to make her do her own podcast because I think she should. So anyone that wants to sponsor that, hit me up. For today, we are going to talk about kin-specific licensing, and with good reason, because as we have discussed on this podcast and reported on in the Imprint, there have been some movements right over the last year or so on this. So Marina, that was a big, long wind-up. Welcome to the Imprint Weekly podcast again. How are you doing?
Thank you. It's great. And I would like you to run the podcast. That makes me very happy. You're great.
100% I'll do it with you. That would be cool. So here's what I think we should do. Because we did talk about the child welfare playbook the last time you were here, but for folks that maybe didn't hear that, give me like the kind of quick summary of sort of what the idea is behind the playbook for folks. And then we'll talk a little bit about the kin rules that have come out, and then we can get to what you're seeing out there as people start to take advantage of it. So let's start with the playbook. What is it?
Yeah, sounds great. So the playbook and the associated working group is really a way for child welfare agencies to easily learn from one another and adopt and adapt things that have already been developed. Something I realized when it started 7 years ago was very often a jurisdiction would be embarking on something for the first time and they'd be like, starting from scratch, right? And as I talked with other jurisdictions, it'd be like, hey, Michigan has a great form for this. Hawaii has a great policy for this. Florida's got a great definition for this. And so we really try to pull those together at the child welfare playbook and make it so that if maybe you have a new policy change or new regulation, or you're embarking on a new change, there's something that you can adopt and adapt and you don't have to start from scratch.
So we're going to talk about kin licensing today. And, we have to, like I said, we've talked about this a bunch of times, but the Biden administration has finalized a rule. And I'm going to let Marina, who has been very much a part of kind of coalescing folks around sort of how to get active and motivated after the rule became final, explain to you one more time sort of what all is in this rule, what has changed as a result of it.
Yeah. So as of December 1st of last year, Title 40 agencies have the option to make a kin-specific licensing or approval pathway instead of using the same pathway for all foster parent licensing or approval. And so that the federal requirements are pretty. It's a small list, which is good. You have to follow the typical normal background check processes that you were already following, whether it's kin or not kin. But then for kin, you have to be reasonably in accordance with the recommendations of national organizations. And the nice thing about this is all the national organizations all came together to co-design one set of model standards for the jurisdictions that do want to adopt them. A bunch of jurisdictions have already gone live, which is just crazy. It is the fastest adoption of a federal regulation I think anyone has ever seen, which really shows like how dedicated to kin and to making this work that so many jurisdictions have. And the many jurisdictions are in the process of updating their state regulations or their state laws right now. So it's not that they're behind. I think almost the entire country will have gone live this time next year, which is pretty exciting.
So I don't expect you to have like a hard number, although knowing you might, but like how many states would you say have already put themselves in a position to adopt the more flexible approach to licensing kin that this rule affords?
Yeah. So 6 states and 2 Title 40 tribes have already gone live. Their Title 40 plans have already been approved. They're already live. Of the entire rest of the country, Title 40 tribes, territories, and states, all but 2 have plans to go live next year. And the 2 that don't very well may go live next year as well. So,
okay. Yeah. And just by way, to Marina's point that this is moving fairly fast, I'm gonna hedge here and say Family First is a much bigger boat to move. But we still have states. I mean, that was passed in 2018, and we still have states that haven't had their plans submitted and approved for that, right? So this is like moving it a lot faster. I don't know if you called it out. I want to make sure. So there's obviously the alternative path to licensing. I do think it's probably also important to point out that the rule makes clear that that doesn't mean you can treat kin differently once they are approved than you would with non-relatives, correct? So whatever you're doing for a non-relative foster home, you got to do for them. And that in particular means money.
Yeah. So the rule also formalizes that you can't be paying a kinship caregiver less of a foster care maintenance payment than you'll be paying a non-kin caregiver. But really for me, like what is so important is there are so many places right now where kin have placement of kids. and they are not getting foster care maintenance payments because they cannot get through the obstacle course that is foster home licensing. And there are some real barriers, like grandma might not make enough money to meet the income requirements to get paid a foster care maintenance payment, which is a really horrible chicken and egg problem. And this, the new kin specific licensing really frees up agencies to say, okay, for kin, where we've already approved grandma as a safe placement, we are not going to require her to meet income requirements in order for her to get a foster care maintenance.
Oh, really? That's interesting. Wow. So they don't have to meet income tests. Okay. All right. So that's kind of the top level view. 6 states are already kind of moving, 2 tribes, and then everybody else for the most part is kind of in the pipeline already, or most states are. So what else are you seeing out there? I mean, I know that you're working with states and talking to people through the playbook and elsewhere. What's on people's minds? What are some of the barriers that people are trying to figure out how to go through? What innovation has kind of this motivated? Like, talk to the people. I'll give you free reign here.
I think top of mind for a lot of people is how to make background checks more kin friendly and faster. Because in a prior world where it was taking 6-8 months to license kin, or potentially you were never licensing kin at all, the timeliness and the kin friendliness of that process wasn't as top of mind. But now in a world where you can license kin the same day as placement, right? Now the fingerprinting and the background checks start being a huge influence here. So a couple of exciting things on here. I mean, many agencies raised up that they wanted to access things like mobile fingerprinting machines or improved background check processes and more kin-friendly, community-based fingerprinting options. And the feds recently updated the Child Welfare Policy Manual to clarify that there is funding available and funding matching. So I heard a lot of excitement around that Child Welfare Policy Manual update. So make sure that you've read that if you didn't. On that topic, the recent Child Welfare Policy Manual update also clarified the definition of relative in the numerator of calculating your penetration rate. And I know one state where that's unlocking $37 million more dollars for that clarification. So if you aren't sure what definition of relative you're using in your numerator, you might want to check out that.
I think I want to. That's extremely interesting, and I don't want to assume that everybody knows what that means. What is a penetration rate as it applies to 4E?
To oversimplify a very complicated concept, it defines how much federal reimbursement you're potentially getting for your 4E administrative costs, or how much reimbursement you're getting for your foster care maintenance payments. And previously, some agencies believed that in your numerator of this, you could count kids placed with relatives who are in pursuit of licensure or approval, which, as we all know, in this previous world could have taken quite a long time. But some agencies believed that the definition of relative for that numerator could only be this super, super restrictive definition that was basically like a few degrees of legal or blood relative. And it was clarified now that you can actually use your definition of relative, whatever you're using for kin-specific licensing, that also counts for who will count in this numerator of when kids are placed with relatives. This is great. This is more consistent, right? It means that as agencies set their own, hopefully expansive definition of relative and kin, that can also count for those kids that are placed with relatives or kin in the process of getting licensed or approved, which again, we're hoping is days in this new world, not months, but that can still really add up, especially if you're a very large system. So checking on what your definition of relative is in the numerator of your penetration rate. Check the Child Welfare Policy Manual changes, the new one. Maybe we'll put in a link, John.
We did a real
big difference.
We did a little summary on it at the imprint, so I'll include a link to that.
Yeah.
There must be some interesting back and forth between states on who they consider kin. It seems like that's different in a lot of different states. So has this prompted some states to consider, changing the way, like as they hear from more other states on this? Like, you see movement there in either direction?
Yes. I mean, I don't want to say who is doing it exactly yet because everybody's in their own process of regulatory change, but there are a bunch of agencies that are working on more expansive definitions. Some in the past few years, like Michigan, really, really crushed it, where they went from a fairly restrictive definition to a really expansive one that's now an example for many other agencies. I think this certainly incentivizes, right? Because an expanded definition of kin and relative right now means that's more places that you can place a child with and approve or license them under this new kin-specific approval and licensing process, which is then more support for those placements and more Title IV reimbursement for those payments. So it's really, I think the incentives are lined up really nicely here.
So as you mentioned, the policy manual changes make clear that there is money on the table, federal money, to help pay for more of the background checks. My kind of recollection was that the background check process in general kind of coming out of COVID got really backed up and there were huge waits. And that was a huge problem in a lot of different corners of child welfare. Is that still the case, or have we kind of unclunked the system to where, you're describing a very fast pace at which theoretically a background check can move forward, but that assumes that there's the capacity to finish one. So are we there or not?
It really varies by the child welfare agency, which I think is a message of hope, because there are some that they can get your fingerprints, process them, and evaluate the results in the same day. And that's really a model to look at. And then for those that are, if you're hearing me say that and you're like, what? How could you possibly do it that fast? There's definitely some models to look at. For example, Minnesota has a community-based fingerprinting provider, and in their contract, the provider has to have an available location to do fingerprinting every 35 miles. So that really starts changing the game in terms of access, especially if you think about a very big state like Minnesota, and making sure that people have a place. If you have to take a day off work and drive for 4 hours or stay overnight to get fingerprinted, right? That's a tremendous barrier that's going to add a lot of time. And then there's places like Utah that have a convening every day of all the decision makers that they need in their agency. So if a kinship caregiver does come back with some results on their background check, that consistent team can look at it, can think through like, what safety plans could we make? How could we get this family to yes in a safe way if possible? Of course, the goal of this is not to approve 100% of kinship caregivers if there are safety concerns, but it's certainly not to get mired in, weeks of serial approvals where it goes to one person's desk and then gets passed along. So having that kind of daily meeting that can go through and also provide consistent and supportive review is really, really key. And the thing that Marina will not stop talking about is now the out-of-state child abuse and neglect registry checks. Now that is the potentially hundreds of days delay in getting kinship caregiver support. And that's something that we can fix if everyone rolls up their sleeves. So as a reminder on that, it's always been the case, and it's still been, well, not always, but been the case for a very long time. And it's still the case now that to approve or license a home, the caregivers and any other adults living in the home who have lived in another state in the last 5 years, you have to check that state or state's child abuse and neglect registries to see if they have any founded findings. It's just being in the registry isn't disqualifying, but you have to know what's in there. Every agency has its own process, and we have actually a list of recommended best practices for this. And if you don't mind, quickly, I'm going to go through them just to remind everybody, because if you're not aligned, I will do anything I possibly can to help you with this. So the best practices are not requiring notarized signatures. Notaries are a huge problem. Think about trying to get 5 adults in one home to one notary to get this form signed, plus the notary fees. I mean, that makes it take months, something that it's not a requirement. And there's a very small handful of states that still have left notary requirements. Get rid of that, please. Similarly, fees. Some states charge $8, $10, and that doesn't sound like a big deal, but it is such a big deal for one state to write another state a check that the social workers end up paying for this out of their office snack fund or out of the water cooler fund. So the social workers are paying for this out of their own pocket, which can really add up. Please stop charging fees. Third best practice is using a centralized inbox. So there's still a handful of agencies where you message like Marina Nitze. And the problem is, like, sometimes Marina goes on vacation, or sometimes Marina retires, which is the scarier part. All these requests go to this person potentially years later after they've retired or left the agency, and there's no feedback loop capturing that. Whereas if you're sending it to a centralized inbox, somebody is always on top of that. Somebody's always fulfilling the requests. The fourth best practice is accepting and fulfilling requests electronically. There's still a bunch of agencies where the request is you mail it in the mail with a self-addressed stamped envelope and you get it back. And that's weeks and weeks that kinship caregivers are not getting licensed. They're not getting foster care maintenance payments. When you can do it through secure email, you don't have to make a portal. You don't have to spend $100 million. There's lots of agencies that accept and submit and send back secure emails. And the last best practice is accepting attestation of consent instead of requiring every person being checked to fill out a separate consent form. So basically what that means is the social worker, when they're submitting the request, they can check a box and they say, I promise I have this person's consent on file. There are 10 states that do that now. We want every state to do that because, again, getting that separate consent form to every single individual, it adds weeks, if not months, to the process. And there are some agencies that take 100 days to respond as it is. So think about how that adds up to 100, 200 days that kinship caregivers are not getting support. The kids in their care are not getting support. because of this. This is just a bureaucratic process, right? We can all collectively fix it. And if you're not sure where your agency stands on this, if you go to childwelfareplaybook.com and click on compare, we have a dashboard that will show you where every single jurisdiction stands on our promising practices. And if you need help, reach out. We are super, super happy to help.
Where should they reach out?
You can reach out to info@childwelfareplaybook.com. And a shout out especially to Wisconsin and Wyoming, because you guys have perfect out-of-state child abuse and neglect registry check processes, and kudos.
You and others worked on, as you described, sort of model standards for all of this. Where are you seeing the most coalescing around those, and where are you seeing states take different, lanes on some of the things that you guys propose in there?
Yeah. So the model standards, agencies have to be, quote, reasonably in accordance with them. So everybody's going to have their own, things that they adhere to, or maybe need to make an exception, especially sometimes there's something that's in legislation that's going to take 2 years. Don't wait to do every last bit, do as much as you can, then you can do the legislation for the last piece. I mean, we are really proud. We co-designed them with kinship caregivers and also with agency employees to make sure that not only can kinship caregivers, it's always going to be stressful to be a kinship caregiver. We can't try to remove we'd be good to try, but we can't reasonably remove 100% of the stress, but we can remove some of it. And where we can, we should. There's been a lot of adherence. So there's a crosswalk, there's an Excel spreadsheet where you can walk through your agency and say, like, we're in accordance, we're going to veer slightly. I would say the ones I've seen so far have been pretty lined up. And the areas where they're diverging, I wouldn't say are as consistent as much as it's something that's hard-coded in legislation somewhere. And so it's just going to take longer to go through it. The examples in that category are some states have state-specific automatic disqualifying crimes that are just, it's really hard. And as we can all imagine, it's hard to navigate going to your legislature and saying, like, it's okay to remove these disqualifying crimes. People hear it as like, wait a minute, you're going to let somebody that commit these crimes, have a foster child? And that's really not the intent. The intent is that you want your agency to have discretion to make the choice for a caregiver and a child in a particular circumstance. And there definitely are circumstances where, it might look like, even there have been stories of, manslaughter where grandma was a victim of domestic violence and it was 40 years ago and the kid now is 17 and a half and they're sleeping on her couch anyway. And everybody agrees that is a safe placement, but because of an automatic disqualifying crime, that placement can't be approved or can't be financially supported. And so really what we want to do is give agencies more discretion around what criminal history is disqualifying or not given a certain situation. So that's come up a bunch. And then there's, always edge cases around. One recommendation we make is around being flexible about the definition of bedroom. States like California have been a leader in this for a long time. And they're saying, it's not okay if the state agency places a child in foster care with a total stranger and they have to sleep on that total stranger's bedroom floor or on their couch. That's not okay. But it's completely okay in many cases to sleep on grandma's couch or to sleep on the floor of grandma's bedroom, or to maybe, and if the family lives in a long home and everybody's sharing one big bedroom space, that's okay. And so you really want to give that flexibility and not have all these edge cases where a completely safe placement, the agency places the child is doing well there, but we're not going to give them a foster care maintenance payment because they can't make it through some bureaucratic barrier.
I think that it's going to be very interesting how states respond to the sort of clarity on the other part. We're talking about the licensing, making clear that there's got to be parity between non-relative foster parents and kinship foster parents is different because, as we know, there are in most states, there is some way in which right now child welfare systems can arrange for kin to care for kids without paying them as much or anything.
Yeah.
Right.
Yep.
And so it was definitely kind of one of the first things as my cynical self on some level think through, okay, so there's these new rules of the road, but is the fact that there needs to be fiscal parity with them going to push more, almost like the same or more reliance on the diversion to occur? But so that is all to say, I kind of want to check in with you and others about what you're seeing, but I just don't, my sense is whatever is going to play out in that space probably hasn't yet. Is that fair to say?
Yeah, I'm certainly not aware of it in a place, but I totally agree with you. It's always important to be thinking about perverse incentives at any time when you change the system. I mean, there's places already like Michigan and Nebraska who have been paying their kinship caregivers full amounts for years without even the federal reimbursement. They said, hey, this process is too hard for our kinship caregivers. We want to support them. And so in those places, I'm not worried about it because they already were really supporting them in every way that they could.
Right.
In other places where there were low to no kinship licensing rates in this new world, like, is it something to keep an eye on? Absolutely.
I guess the place, I'm not thinking of any specific state here, if there was a state where there was going to be a perverse incentive alert, it would be a state that had been approving formally kinship caregivers for a long time at a high rate, but not supporting them at the same fiscal level. If that makes sense.
Yes.
Right. Because now all of a sudden it's like, well, we've been doing this, but we've been doing this with non-parity. And now the feds are telling us we have to. Would that go the other way there? I don't even know what state that would be.
It's always important to watch perverse incentives. And as much as I've loved all the movement towards kin, at some point, pendulums shift all the time, right? So we want to keep an eye on that too.
Yeah, for sure. All right, Marina Nitze, first of hopefully many times, she's going to come on and talk to you about what's up at the Child Welfare Playbook, what they're talking about, interesting stuff like this. Thank you for joining us on the Imprint Weekly Podcast.
Thanks, John.
Thanks to Marina Nitze of the Child Welfare Playbook for joining us today. The Imprint Weekly Podcast is a production of the Safe Camp Audio Network, which is a division of Fostering Media Connections. Please visit safecampaudio.org on the web or at safecampaudio on all major social media. This podcast is produced and mixed by Christine Anjoko with music by Luke Giroux and Cyrus Elia. If you enjoyed this episode, we would love it if you'd consider subscribing or giving us a 5-star rating on Apple, Spotify, or wherever you download your podcasts. And we would greatly appreciate if you would consider supporting our work here on the podcast and in print. Small donations from our listeners and readers go a long way towards helping us grow and cover more great stories in child welfare and youth justice. To support us, it is super easy. Just visit imprintnews.org/donate. You can follow The Imprint on Twitter and Facebook by searching the handle @TheImprintNews and visit us on the web at imprintnews.org. And you can always email us at tips@imprintnews.org. I'm John Kelly, and we'll see you next week.